The World Health Organization today added gaming disorder to its international classification of diseases, meaning it's now certified as a psychological condition. For the majority of the more than 2.6 billion gamers worldwide, it's not a problem, but for a small number, excessive gaming can derail their lives. Joining me now to unravel the science is Dr. Andrew Campbell, Chair of the Cyberpsychology Research Group at the University of Sydney. Dr. Campbell, thanks for being here tonight to take us through this. Just define exactly what gaming disorder is.
Gaming disorder is really sort of divided into two. The first part is where we actually see that we're losing a lot of time, we're losing a lot of quality of life in some ways by actually spending too much time online. On the other side, the really severe end, which is what the ICD is really looking at, is those who are actually shutting off portions of their life to the detriment of their health.
And what's the scientific evidence behind it? How did the WHO come to this conclusion?
Well, that's a very good question. We haven't really seen the actual outlay of the criteria yet. What we are seeing, though, is they're focusing on groups of people that have actually ceased to function in quite productive ways. They're not eating, not sleeping. They have social relationship problems that are quite severe, outbursts of aggression, and those sorts of things that I'd say are probably going to be in the ICD-10, but we've yet to validate that.
And so the WHO, by listing gaming disorder as a classified mental health condition, what does that say about why would they have done that?
I think one of the things we've been concerned about for some years is that the disorders that have come from gaming disorder or have been labelled on gaming disorder look very similar to some other disorders, anxiety, depression, substance abuse and things like that. But in the regards to youth, where particularly the disorder has been most found, we're more concerned that this is something that needs to be treated at its source. So that's probably why they're looking at it now.
And I wanted to ask you about that. You mentioned youth. Who typically does gaming disorder affect, and is it a growing problem?
The problem's been around for some time, but it's probably important to state that it's a small group of the population. So 2.6 billion gamers are not all suffering a gaming disorder. Those that are very severe, more often there's probably a comorbidity. In other words, they probably have had depression, they have personality disorders, they may have other particular issues that they're concerned with, that they use gaming to cover up, that they actually want to engage with, and the gaming becomes their world. So we're looking at a population there of maybe 1% of that, maybe less, that really are disengaging from life, and they're using too much time online to replace face-to-face life.
What have you seen about gaming disorder in Australia? I know that in a 2016 Digital Australia report, it found that Australians might be more addicted to gaming than their US counterparts, racking up 11 hours a week on average. Is that a problem?
Yeah, it definitely is a problem, and it's one of the things we need to look at from a point of digital citizenship. If we teach citizenship to kids, which is all about how to be a good person, don't bully, eat the right foods, sleep, exercise, we should be teaching that in the online world as well. The thing is that if we're spending 11 hours online not knowing what we're doing, and which is often what parents don't understand what their young people are doing, we need a better education program for families as well as children.
And is there a distinction when it comes to the terminology between a disorder and an addiction?
Yeah, there definitely is. The disorder is something that you could say is the beginning of the slippery slope. We need to actually address it. It's a problem, and there's good ways to have conversations about why you're doing this. Let's supplant it with other good, healthy behaviours. The addiction side is really when we're getting to the point where the person is having trouble returning to functionality and is not listening to rational argument.
And so what should parents look out for?
Look, the number one thing is time wasting. We need to address that. Social skills. We also need to look at good bedtime. Sleep is incredibly important. And manners. I mean, one of the things that seems to go is that they seem to be very demanding and aggression goes up. All of these signs are worrisome, but it doesn't mean that it's at the point of no return. We really need to do a lot more research on it, though.
What about those children who have televisions or consoles or PCs in their bedroom and their parents think that they're asleep?
Look, the number one thing I would say, and I have to many of my clients that have seen me over the years, is that it's not good to have devices unsupervised, particularly under the age of 15, and that they should be in common areas and used at specific times.
And what treatment options are available if parents have identified that they think their child has a problem? What should they do next?
Look, the very first thing is definitely talk with their teachers, but also consider getting a mental health care plan. You can do this through Medicare. You can go and actually talk to psychologists and social workers and counsellors and start learning about what other problems might be there, because more often than not, it's overlaid. It's not just the gaming disorder. There might be something else.
Okay, Andrew Campbell, thank you so much for speaking to us tonight.
Thanks for having me.